Your doctor checks your blood pressure, says 148/78, and you think, well, the bottom number looks okay. DOC, the bottom one's fine, right? I hear this every single week. Patients point at that second number like it's a safety certificate. After 20 years as a cardiac surgeon, I'm telling you straight that thinking has put people on my operating table. The number that matters most after 60 is not the one you've been watching. And today, I'm going to change that. In the next 20 minutes, I'll show you exactly which number to watch and why your arteries after 60 play by completely different rules, and what you can do starting this week to protect yourself without waiting for a crisis. Stay with me. This one is genuinely important. Blood pressure after 60 is a different conversation entirely. Most people learn about it in their 40s, cut back on salt, life moves on. But the way your cardiovascular system handles pressure changes dramatically as you age. What was manageable at 45 can be genuinely dangerous at 65. Same numbers, different body, different risk. What was harmless at 45 can be quietly dangerous at 65. So, let's get the language right. When your doctor reads your blood pressure, you get to numbers. 148/78, for example. Let's break that down. That first number, 148, is your systolic pressure, the force your heart creates when it squeezes and pushes blood out into your arteries. Think of it as the peak pressure, the moment of maximum effort. The second number, 78, is your diastolic, the pressure when your heart is resting between beats. For decades, medicine focused heavily on that bottom number. Diastolic hypertension was considered the main threat. For younger adults, that's still a valid concern. But something shifts after 60. The relationship between those two numbers changes fundamentally. And the risks, the ones that can actually kill you, change with it. Here's the core of what I want you to understand. After 60, your arteries are not the same flexible tubes they were at 30. They've stiffened. And that single biological fact changes everything about which number deserves your attention. And frankly, your doctor's focus concern, the stiff pipe problem. Imagine your garden hose in spring. Flexible, soft, bounces back when you squeeze it. No resistance at all. Now picture that same hose left outside through 10 winters. Rigid, brittle. You bend it and it cracks. That's what happens to your arteries over time. Not because something went wrong, because that's biology. Collagen fibers gradually replace the elastic tissue. The walls thicken. The vessels lose their ability to expand. When your heart contracts and pushes blood out, healthy young arteries act like shock absorbers. They expand slightly, then spring back. The peak force stays controlled, but stiff arteries can't do that. When your heart pushes, there's nowhere for that pressure to go. The wave hits a rigid wall and bounces back hard. Your systolic number spikes. Meanwhile, diastolic pressure can actually drop or stay flat. And this is where people get dangerously confused. This is why so many people over 60 end up with a high top number and a perfectly normal bottom number. It's not reassuring. It's a warning sign, and it has a name. Isolated systolic hypertension. Your TOB number consistently at or above 140. Your bottom below 90. Normal bottom high top. Patients with this pattern often feel completely fine. No headaches, no dizziness, no dramatic warning symptoms. So, they dismiss it, and that's exactly the danger. My bottom number is normal. I must be doing okay. I've had this conversation more times than I can count, and every time it troubles me deeply. The research is unambiguous, and I want to say that clearly. Isolated systolic hypertension is not a quirk of aging. It is not something to simply accept and ignore. It is one of the strongest predictors of heart attack, stroke, and heart failure in adults over 60. Stronger than elevated diastolic pressure alone in this age group. A landmark study found that every 10-point increase in systolic above 140 raised cardiovascular risk by roughly 20%. 20% for 10 points. Think about someone sitting at 160 systolic, pointing at their 75 diastolic and feeling relieved. That gap is carrying real life-shortening risk. Here's a question worth sitting with. When did you last check your top number at home, not just in the doctor's office? Write that in the comments. I've spent 20 years in operating rooms dealing with the consequences of unmanaged pressure. I'd rather talk with you now than meet you under very different circumstances later. Let me tell you something that doesn't get nearly enough attention in routine checkups. Your brain is the most pressure-sensitive organ in your body. It runs on a constant, carefully regulated blood supply. Tiny vessels, some thinner than a human hair, feed billions of neurons around the clock. And those tiny vessels are the first casualties of chronic high systolic pressure.
Every surge, every beat at 150, 160 sends a small mechanical shock. Once in a while, manageable. But when it happens tens of thousands of times a day for years, those vessels begin to thicken, narrow, and stiffen. Some develop tiny tears. Some simply close off. Small areas of brain tissue quietly lose their blood supply. You don't feel it happening. There's no dramatic moment, just a gradual, invisible erosion. And then one of two things happens. Either a larger vessel gives way, that's a stroke, or the cumulative damage builds slowly into something that looks almost exactly like Alzheimer's disease. This is critically important and most people don't know it. Vascular dementia, dementia caused by damaged blood vessels in the brain, is frequently misdiagnosed as Alzheimer's, even by experienced clinicians. The memory lapses, the confusion, the personality changes. They can look identical in the early stages, but unlike Alzheimer's, vascular dementia is substantially preventable. Controlling your systolic pressure is one of the most powerful tools we have to protect the brain. That's not a small claim. That's the science. Think about someone you know who seemed to just get forgetful in their late 60s or 70s. We often accept that as inevitable aging. Sometimes it genuinely is inevitable aging, but sometimes it was entirely preventable. And that is a hard truth worth sitting with. Seriously, when your doctor talks about blood pressure management after 60, they're not just talking about your heart. They're talking about keeping your mind sharp, keeping you independent, keeping you present for the people who matter to you, keeping your mind in the room. The stakes here are that high. The brain gets a lot of attention when we talk about blood pressure, rightfully so. But high systolic pressure doesn't stop at your neck. It's a whole body problem. And the damage it causes elsewhere is just as serious and just as silent, which makes it just as dangerous. Start with the heart itself. When systolic pressure is chronically elevated, your heart works harder with every single beat, pushing against higher resistance every minute. The heart muscle responds the way any muscle does to overwork. It thickens. The left ventricle enlarges. Sounds like it's getting stronger. It's getting worse. A thickened heart muscle becomes less flexible, less efficient. It fills with blood less effectively between beats. Eventually, heart failure, common in older adults, difficult to treat once established, far easier to prevent than to manage. Then there are your kidneys. They filter your entire blood supply dozens of times every day through tiny vessels. Chronic high systolic pressure damages those vessels over years, gradually reducing kidney function. What's insidious is that you don't feel it until significant damage has already occurred. By the time routine blood tests flag a problem, meaningful damage has already happened. That's the trap with silent organ damage and your eyes. The retina is lined with tiny blood vessels highly vulnerable to pressure damage. Hypertensive retinopathy can silently degrade your vision over years. In severe cases, it can trigger sudden permanent vision loss. Brain, heart, kidneys, eyes. This is why I call high systolic a whole body problem. Here's the question I want you to ask yourself honestly. How long has your systolic number been above 130? A year? 5 years? 10? The damage I just described doesn't happen overnight. It accumulates quietly, which is exactly why the time to act is now, not after a symptom appears. Let's talk numbers. For most adults over 65, current guidelines set the goal at below 130 systolic, not 140, 130. For years, doctors accepted higher readings in older patients. The prevailing idea was that some elevation was just normal aging. Then a trial called SPRINT changed everything. SPRINT followed thousands of adults over 50. The group treated to below 120 had dramatically lower rates of heart attack, stroke, and cardiovascular death. The trial was stopped early because the results were so clear. Your doctor will calibrate your personal target, but the direction is unambiguous. Lower systolic saves lives after 60. That is what the evidence says clearly and consistently. So, where is your number sitting right now? Before we talk medication, let's cover what you can do starting this week without a prescription. These are real interventions with measurable impact on systolic pressure. I've seen patients drop their top number by 15 to 20 points through lifestyle changes alone. That's the difference between needing one medication and needing 3. First, sodium non-negotiable after 60. Your kidneys clear sodium less efficiently with age, so salt hits your pressure harder now than 20 years ago. The target is 1,500 to 2,000 milligrams per day. 1 teaspoon of salt contains 2,300 milligrams. Start reading food labels today. The biggest offenders are not the salt shaker. They're bread, canned soups, deli meats, and restaurant meals. Those for alone can push you over your daily limit. Second, weight. Every excess 10 pounds raises systolic by 4 to 5 points. Losing those 10 pounds brings it back down. Not aesthetics, hydraulics.